it's been around forever. It works. So HGH, it's released. We have right square here is something called our pituitary gland. The front of the pituitary gland is the anterior pituitary gland that releases human growth hormone. But it's not the human growth hormone that does all the work. Human growth hormone then goes to our liver, and from our liver, it releases something called IGF-1, which stands for insulin-like growth factor 1. And you can see from this slide, no need to see where it's going. Just look at in the green box, you see insulin-like growth factor 1 and all the different places that it affects, all the different organs that it has a role in. It helps the brain. It protects the heart. It builds muscle, builds bones, helps with ovarian and testicular function. It helps growth and repair, protects the kidneys, and then helps the immune system. This slide is one that I love showing to all my patients because it tells them when you see in the brochures and when you read about HGH and Somaderm, and my goodness, look at all, is it too good to be true? There's no question in my mind that it's not too good to be true. This is just IGF's job, and this illustrates it. For some reason, this growth hormone in our system peaks at age 20, 25, usually out of our system. The anterior pituitary stops making growth hormone roughly by the time we're 30. And then the dreaded aging process starts at that point. But just because the anterior pituitary stops making it doesn't mean that it's gone, that there's still, it can still make growth hormone. It's just programmed not to. But can we turn it back on? Of course we can. And that's called hormone signaling. So a quick difference between hormone replacement and hormone signaling is I'm on testosterone. My body no longer makes as much testosterone as I need. So therefore I need to replace my testosterone. With Somaderm and HGH and the gel is we're getting just enough absorbed through the skin to light the burner called our anterior pituitary to release growth hormone. It's signaling the anterior pituitary to wake up and release more growth hormone, which releases IGF, which then does all of these wonderful, amazing things in many different areas of our body. So yes, you're going to sleep better. Yes, your muscle is going to grow. Your fat's going to go down. It takes time. Everybody has to understand that this takes time. It's not going to happen overnight. You may notice an increase, a better sleep, but really 4, 6, 8 weeks down the road is a really good time frame to know when you're going to start seeing the first couple of benefits. But then it's a cumulative effect, and it keeps going through the months, and that's well explained in all the websites and the literature. We cannot turn this back on. You're not going to see results overnight. It takes time. Patients have to understand that. But this is why this is one of the main ingredients, and it has these incredible properties that hit all these different organs. So, and like Stephanie was saying, we also have the glandulars and the herbs, which just makes this gel an amazing, amazing product. So, and to prove that the growth hormone is doing its job, so I decided to purchase a machine for my office that basically looks at whole body composition analysis. So it takes into account water weight. So I can measure a before and after muscle mass, fat mass, water mass. So what I did was all my patients that started on growth hormone on the Somaderm, I got a baseline, and 4 weeks later, without them changing anything else except the growth hormone, I repeated their whole body composition. And every one of them so far has shown an increase in muscle mass and a decrease in body fat, and that's just at 4 weeks. I'm still doing 8 weeks, 12 weeks, because there is that cumulative effect. But even at 4 weeks, I have cases where I took a physically fit patient and made him more physically fit. I took the overweight patient and made him drop 12 pounds instead of his usual 2 pounds in 4 weeks, while seeing the changes in the body mass as well as the body fat. And obviously that's abdominal fat, which I'm trying to get off as well. That comes with increased risk for diabetes, heart disease. Heart disease is the #1 killer in the United States right now. Once we get rid of that body fat, now I know that I'm making my patients live longer and improving their quality of life, while I'm actually adding all the other stuff, which are the hormones, the herbs, the glandulars. So it's a great jump start. It's not the whole story, but it's a big part of the story. But I've proven with I have created a biometric. I've created a set number that I can show a before and after effect with controlling all the other issues. They only added Somaderm. And so there's more studies to come, I'm sure, that will prove that it's doing what it's supposed to be doing, besides people, just thousands of people feeling better. Traditionally trained docs, I am trained on double-blind, placebo-controlled, show me the numbers, show me this, show me that, and then we forget to ask the patient how they're feeling. I mean, so believe me, and now I actually have the numbers and the stories to go with it. So it's been a fantastic addition to my treatment regimen.
Oh, that's fantastic. How many patients do you have on the product?
In my practice, I have close to 200 right now. But
Wow.
I also have about
all of them?
Yeah, well, I have 8,000 patients but the only reason I'm at 200 is because I can only see so many in a week. Because once I tell them what my own personal experience and my medical advice, then they get on it. And now pretty soon I changed my website to get a blast email to everybody, because I don't want patient number 7,000 to find out about this 6 months from now if I'm seeing them in a 6-month visit. So it's really something that I just need to get the word out to all my patients, because they're all feeling great on it. That's for sure. I haven't had, and again, I was expecting somebody to have a side effect or some problem with it. And I have actually found none so far. But then you deal with it just like anything else. But the side effects are less because it's not a drug. I'm not giving a mega dose of something that comes with side effects. It's very hard for our body to produce something that's going to give us side effects, because our body's in charge of it. Our anterior pituitary is basically making the growth hormone that's causing the IGF to be released. So I'm not forcing it upon them. What I'm very proud of is I'm taking my gym rat friends. I'm 50, and I've got these guys who are still hanging on they still want to be bodybuilders, which is great, but let's do it naturally. And I'm taking them off the dangerous stuff from China and the injectable, and I'm switching them over to this, and they're liking it. And but I know I'm making them healthier. I'm taking them out of that danger, and now I'm actually creating health, and they're seeing all the other added benefits that Stephanie and Carrie are going to talk about, the added benefit of the glandulars and the herbs. So now they don't have to spend all this money on the vitamins and et cetera, et cetera. So that's I'm proud of that, because that was a tough sell, if you will. But I said, that's dangerous. This is not, let's try it. And now 12 weeks into it, they still maintain their muscle mass. And now they're feeling healthier, and they are healthier.
And they are healthier. And that's a huge key.